Hello, doctors. Today we are discussing about the topic immunization schedule in pregnancy and drugs used in the pregnancy. So we'll look at which vaccines are safe, which are contraindicated, and then move on to the how we approach drug use during the pregnancy in today's topic. What it is safe, what it is risky, and how we can manage the patients both in OPD and IPD basis. So let's move forward to the topic. Talking about the pregnancy, it is like a very unique physiological state. The mother's immunity is slightly altered, and at the same time, we must protect both the mother and the baby. So, immunization plays a very big role in preventing any infections during the pregnancy. And on the other hand, drug use in pregnancy is very tricky also. We have to balance the maternal benefit against the possible harm to the fetus. So, both the topics are about prevention and safety. So, it is like a pregnancy is very special physiological state requiring any preventive care. So, immunization is very important during the motherhood because it will helps to protect the mother and fetus from the any kind of infection. So also during the pregnancy time it is very risky to advise any drug, and you should be very aware about the drug usage during the while advising to the mother, because it can sometimes harm the baby also. So to be safer side, you should be always know the what which is very good to advise, and what is safe and what is risky, and how we can advise the patient to take the drugs. So it is very important to know the immunization schedule or the during the pregnancy, and always be very careful to know the when advising any type of drug to the female who is pregnant. Immunization in pregnancy. What are the key principles here? So, some basic principles before we talk about the specific vaccines we should know. First is only vaccines proven to be safe in pregnancy should be given. Second, live attenuated vaccines are contraindicated. Be careful because they carry a theoretical risk to the fetus. So, always know that live attenuated vaccines are contraindicated during the pregnancy. Next, third is inactivated and toxoid vaccines are generally safe, and the most important point here is immunization protects not just the mother but also the newborn through the maternal antibodies. So these are the basic key principles you should know about immunization during the pregnancy. Only vaccine safe in the pregnancy should be given. Live attenuated vaccines are contraindicated in pregnancy, and inactivated and toxoid vaccines are very generally safe during the pregnancy, and immunization will provide the maternal and neonatal protection. So this is the key principles. Moving on to the essential vaccines. So these are different types of vaccine which is essential. The only vaccine that is universally essential in pregnancy is tetanus toxoid or TD, TT or TD vaccine. Two doses are recommended. The first dose is as early as possible in the early pregnancy. Second dose at least 4 weeks later you can advise. Next, if the mother has already been immunized in a previous pregnancy, a single booster dose is enough for the patient. So this is like a life-saving vaccine. It will helps to protect the both mother and baby against the maternal and neonatal tetanus. So this is the important essential vaccine, that is tetanus toxoid or TT or TD vaccine. It is very important. It protects both the mother and baby against the maternal and neonatal tetanus. Okay, this is the only vaccine which is very essential for the pregnancy during the pregnant time. Next, moving on to the optional vaccines or indicated vaccines. So there are some vaccines that are given depending on the situation or the condition. First is influenza vaccine. It is safe in all trimesters, but Usually, we can give the influenza vaccine in the second or third trimester, and very important because it is very important because flu can be severe in pregnant women. So this vaccine is also important. Second is hepatitis B vaccine. So if the mother is non-immune and at risk of getting hepatitis B, then hepatitis B vaccine can be indicated. Third is COVID vaccine. Strongly recommended, as like whenever COVID increases, maternal morbidity and preterm births are usually increased during the COVID. So COVID-19 vaccine is very important to reduce the maternal morbidity. Fourth one, other vaccines like, for example, typhoid, cholera, or meningococcal. Are these types of vaccines are given only in any special exposure, like if the patient is at risk of getting all such conditions, then these vaccines like typhoid, cholera, or meningococcal are given, are indicated during the pregnancy or motherhood. Okay, so these are the optional indicated vaccines during the pregnancies. Next is the contraindicated vaccines in pregnancy. What are the types of vaccines which is contraindicated, will not be indicated in the pregnancy? All live vaccines, like as I've mentioned in the previous slide, live attenuated vaccines are contraindicated. So all the live vaccines, like measles, mumps, rubella, MMR, varicella for chickenpox, oral polio vaccine, yellow fever, except if absolutely unavoidable for travel, then okay. These are not given during the pregnancy because of the high risk. So but they can be given safely before the conception or after delivery. But during the pregnancy time, it is very important to know that live attenuated vaccines are avoided, like measles, MMR, chickenpox, oral, and yellow fever. So this is the contraindicated different types of vaccine which are contraindicated during the pregnancy. Like these are this if you want if the patient requires, the vaccines can be given after pregnancy, like after delivering the baby or before the conception, the pregnant patient can take. But during the pregnancy you should avoid this type of vaccines. Moving on to the drugs in pregnancy. So what are the drugs which is like completely safe and all? So the one rule is no drug is completely safe during pregnancy. So every prescription should be based on the risk benefit analysis. So there are few general principles like, use minimum effective dose for the shortest possible duration, and avoid any polypharmacy. Always consider which trimester the patient is in, because some drugs are harmful during the early pregnancy and some drugs are very harmful in the late pregnancy. So always consider which trimester the patient is in, then advise and prescribe the drugs to the patient. So earlier we had the FDA categories like A, B, C, D, X and all, but now this has been replaced with a detailed narrative labeling. So trimester is like a specific, in every trimester it is like a specific risk must be considered, because during the early pregnancy also there are chances of getting having a high risk of getting any, it's not like safe. And even the first trimester, second trimester, third trimester, so before prescribing any drugs to the patient, make sure that always consider, ask the patient about which trimester is in, and based on that you have to prescribe the medicines. Next is the teratogenic drugs must avoid. So now very important, which drugs are teratogenic and must be avoided. First is thalidomide. Thalidomide drug is avoided it because it can cause limb defects. Isotretinoin causes severe craniofacial and cardiac malformations. ACE inhibitors or ARBs, which can cause kidney problems and oligohydramnios, and warfarin, which will cause fetal warfarin syndrome with skeletal defects. Tetracyclines can lead to discoloration of teeth, bone defects, and all. Last is valproate. Valproate is can cause a neural tube defect. So uh, these drugs are teratogenic drugs and must be avoided during the pregnancy. So these are like classic, we can call like red flags, drugs which should never be prescribed during the pregnancy or to the mother during the pregnancy or motherhood. Okay, this is the key important points you have to note it down. Next is the what are the drugs which is relatively safe drugs. Like on the other hand, like some there are some drugs which are considered relatively safe and widely used. First, paracetamol. It can be preferred for they are the preferred analgesics and antipyretic. Penicillins and cephalosporins are like safe antibiotics. Insulin, it is like a drug of choice for the pregnant for the women who are who may be kind of like diagnosed with diabetes in pregnancy. So insulin also preferred in diabetes, the drug of choice. Next is labetalol and methyl dopa. So these two drugs are preferred drugs for hypertension. So if the patient or the mother is diagnosed with a hypertension in the during pregnancy, this can be advised. Next is ondansetron and doxylamine. Ondansetron and doxylamine are safe for nausea and vomiting in the pregnancy, so that these things you can advise to the patient. So these are go-to choices when needed. So these are the things which are relatively safe drugs during the pregnancy, and you can. But as I was already mentioned, no drug is completely safe, but compared to that, you can relatively safe drugs are these list. So you can advise these, but consider properly, diagnose the condition properly, and consider the trimester in the patient of the patient who is pregnant, which trimester is in, and prescribe the drugs. And these are the key safe drugs, you can note it down. Moving on to the drugs to use with the caution. So before prescribing any drug, like you can these drugs can be used but with a caution. First one is NSAIDs. Avoid especially in the third trimester because they can cause any premature closure of the ductus arteriosus and oligohydramnios. So these can be avoided in the third trimester. Next is aminoglycosides. It can increase the risk of ototoxicity. Fluoroquinolones, that can lead to risk of cartilage damage. SSRIs may be needed for depression can carry some carry some risk. But in case of severe depression, you can advise. Corticosteroids should be used only absolutely necessary. So only until and unless it is necessary, don't prescribe corticosteroids. Only when if it is necessary, it is very important to prescribe, then only you can prescribe the corticosteroids. So these are the list of drugs which is very like you can prescribe. It is useful also. You can prescribe the for the patient, but only with the caution. Moving on to the OPD management. So how you can manage the patients in the OPD. For immunization, like routine antenatal OPD care should be given to the patient. So during that, you can do the immunization, ensure the TT and TD vaccination is completed during the antenatal care, and give influenza and COVID vaccines when indicated, and prescribe safe supplements like iron tablets, folic acid, calcium, etc. For symptoms like fever or pain, prescribe paracetamol, doxylamine. These are the safer drugs. And for nausea and vomiting, doxylamine or ondansetron can be prescribed. And very importantly, we must educate mothers to avoid any self medications. So, if, for example, if the patient is suddenly got fever and not able to consult with the doctor, so they might think it's very okay, I can take the medications, no problem, safe, tomorrow we'll consult the gynec. No, so that you should during the antenatal care checkup itself, you should educate the patient that don't take don't take self medications, because it can sometimes lead to complications, because they might don't know what their body changes and hormone changes, what is happening inside their body, so they don't know what is safe or not. So there will be patients who might get advice from many other colleagues or something, you can take their medicines, no problem, no issues, but every body is very different from each other, so you have to always advise them not to self medicate for any conditions, only take medications, consulting their gynec or doctor before taking any medications. Fine, so these are the OPD management and advices you should give to the patient when coming to the antenatal checkup. Moving on to the IPD management. So how we can manage the or we can handle the high risk cases in the IPD. So for severe infections, use safe antibiotics with cautions, like for example penicillin or cephalosporins. For hypertension and preeclampsia, you can use labetalol, hydralazine, and magnesium sulfite for eclampsia. For diabetes, insulin is always preferred, that is the drug of choice. And for seizure disorders, you can advise drugs like levetiracetam or lamotrigine are safer compared to the valproate, so that you can advise. So drug choice must always balance the maternal health and fetal safety. So this you should remind. So in IPD management, the rule is like to treat the mother properly by while always choosing the drugs that are safest for the fetus also. So you should not only see the mother's health, you should also check for the balance the health of both mother and the fetus, because during the pregnancy time you should always consider the both mother and fetus before consider leading to any or treating or managing any condition during the pregnancy. So this is how we can manage the patient in the IPD basis. So to summarize our today's topic, immunization during pregnancy is very important to protect mother and child. TT, TD for all, and influenza and COVID vaccines are strongly recommended. Live vaccines are contraindicated. Drug use must always be cautious. Know which drugs are safe and which are teratogenic, which must be avoided, and which needed careful monitoring. Next, in OPD basis, OPD management is mainly preventive care and symptom control, noted down. And IPD management, we usually focus on the high risk management with the high risk cases with safe evidence based drugs. So this is the important key points you should be aware of while treating the patient or immunizing the patient. So during pregnancy, always consider both the mother and child health. And as I've mentioned, for all the pregnancy women, the TT and TD vaccines are very essentials. And there are other types of vaccines also, it can be given only if necessary and if it is required. And always note, live vaccines are contraindicated, it should be avoided, live attenuated vaccines. And there are few drugs which are safer side, you can use and you can prescribe to the patient. And there are few drugs which should be avoided also, there are list of drugs which should be avoided during the pregnancy. And there are few drugs which you can use but with a caution. So before prescribing any drugs to the patient, always think about the patient's like which trimester the patient is in. Always check for the clinical features of the patient, and do the necessary management to the patient. So this concludes our lecture on today's topic, immunization and drugs in pregnancy. So that's it, we'll wind up today. Thank you so much for patient listening. Have a good day.